Hello everyone, my name is Jake and today is my 2-month follow-up after my L5-S1 microdiscectomy. And today I just wanted to share a few things with you. First, how my doctor's visit went, the follow-up after my surgery. Second, how I'm doing at 2 months physically. And lastly, just a couple of things that have helped me cope with my surgery and hopefully could help someone watching this video. So I hope this follow-up is helpful to those of you who might be facing surgery and are wanting to know what you can expect. So my doctor's visit was at about 4 weeks after my surgery, and I met with my doctor. They just wanted to make sure that the inflammation was decreasing at the incision site and that there wasn't any infection, and both of those things were looking good. They also taught me about the BLT acronym, which is no bending, lifting more than 10 to 20 pounds during your recovery, and no twisting at the waist. So that's been really helpful to not re-herniate. And I asked them about starting physical therapy, and they said that they didn't want me doing any kind of exercise besides walking for the first 3 months. And that's just because they really want you to avoid a re-herniation. And so I've heard of other people who have started exercising sooner than that with physical therapy. And that's fine if your doctor tells you to, but you'll just want to still take it really gradually and be careful so that you don't re-herniate that disc. I was kind of hoping that the doctor would pull out a crystal ball and tell me, this is a list of things you can do and this is a list of things you'll want to avoid. I used to play tennis and soccer, and I'm hoping to go finish school, but they said some people are able to exercise again as they did before and other people aren't. So you just have to listen to your body, and hopefully with time you'll be able to tell what you can do, because everyone's different. So I'm looking forward to starting to exercise. So how I'm feeling at 2 months, things are going pretty well. I have 0 sciatic pain down my right glute and right calf still, so that's pretty awesome to have that gone. I do have some discomfort in my lower back, probably once per day. And it's usually due to me sitting down too long. It's not a nerve pain, but it's a tightness, probably just due to the surgery, so I'm hoping that will go away in time, and icing it usually will completely get rid of it. I haven't taken ibuprofen or any pain pills since 1 week after my surgery, so that's been really nice as well. And the last thing to report, I guess, is that there's still numbness in my right foot and toes. That was present before the surgery, but it's not a huge problem. So I just wanted to end on giving you a couple of tips that have helped me deal with my recovery, and hopefully they can help you. Okay, so the first tip I wanted to share that's helped me is related to sleeping at night. So after my surgery, my doctor instructed me to sleep on a hard or firm surface. That's because if your hips sink too far down into a soft surface, such as a couch, it can mess with the curvature of your spine and permanently mess that up. And I've noticed that when I sleep on a soft mattress, I also have pain in my lower back. So something that's helped me to avoid that is getting either a towel or a folded blanket, such as this, and simply placing it under my lower back and hips. And that way, rather than having a dip in your bed, it's more flat, and it has taken away the pain as well. So the second tip I wanted to share with you today is how to properly pick things off of the ground while keeping your back in good form. So my assistant Nathan is first going to demonstrate how to incorrectly pick things off of the ground. As you can see, there's a lot of flexion in his back, and that's probably going to harm you in the long term if you do that too many times. So I'll now demonstrate how the doctors have told me to pick things off of the ground. That's simply by bending your knees while keeping your back in alignment. And that's how I've been told to pick things off of the ground. But I've noticed that when I do this multiple times, my knees start to hurt within a few minutes. So something that I've learned how to do that helps me is to do more of a lunge. So that's simply done by putting one leg out and bending down. And you're going to look like a complete fool if you do this in public, but you have to pick your battles. I hope this has been helpful to those of you who are wanting to know what to expect with microdiscectomy surgery, and I will post a 6-month and 12-month follow-up, and hopefully those can help out as well. Thanks. Bye.